Hi, welcome. Come in, take a seat. How are you today? Okay. I believe you're my 4 o'clock appointment, is that correct? Wonderful. And you're here today for a full comprehensive examination. Today we'll be exploring the cranial nerves, but I'll also be giving you a full physical. I'll be checking your scalp as well as skin quality and texture. Is there anything else that was concerning you wanted me to check? Okay, so we'll just go as in depth as we possibly can today. We've got the time, alright. Let me take a little bit of information from you. We'll do a bit of a intake before we begin. This way I can figure out, based on the questions that I ask you, if there is anything in particular that I should be concerned about. Just grab my pen. Alright, so if I could take your name first. Just for my notes. And your date of birth. Okay, and could I just take a phone number so that I can contact you directly if I need to? Great. Okay, so if you could identify 3 main areas in which you could say were the reasons that you booked this appointment today. Okay, that's fine. So just to confirm with you, your concern regarding some hearing loss, scalp sensitivity, and a potential lump behind your ear. Okay, that's fine. So we can focus on those, but we will go through absolutely everything at the same time as you book the full health checkup. So regarding your lifestyle, if you could rate your general diet on a scale from 1 to 10, so 1 being fast food every day, little to no protein, vegetables and fruit, and then 10 being, really balanced, making sure that you're, eating your fibre and veg every day, having healthy whole grains, healthy fats, lots of protein, good varied diet. Okay, an 8's quite good. Alright. Okay, and then how about exercise? How would you rate your exercise throughout the week? Would you say that you're a very active person? On average, do you know how many steps you're getting a day? Do you wear a Fitbit, Apple Watch, exercise tracker of any sort? Okay. And how about exercise? What is the type of exercise that you prefer? How often do you take part? Okay. And how often do you play that? 3 days a week? Any other exercise? And how often is that as well? Okay, 3 days a week. Very active then. That's great to hear. How about your liquid consumption? Are you consuming a lot of water, more than 2 litres a day? Yeah. How many units would you say that you drink a week? You're teetotal, that's fine. Okay. Have you ever or are you currently a smoker? How about vaping? Do you undertake any activities that would be considered dangerous? Okay. Are you currently on any medication? Okay. And have you ever used or are currently using any illegal drugs? Okay, so could you tell me a little bit about when you first noticed this hearing loss? Okay, and was it sort of an all of a sudden you noticed a difference, or was it more of a gradual progression? Sudden change. Okay. Is it on both ears or just on one side? Your right ear. Right ear. Okay. And have you ever had ear cleanings before? No. Okay. Ever suffered with wax build-up? No. And have you ever experienced any hearing loss like this before? Okay. Was there anything that happened, occurred around that time that you can think of that may correlate? So, for example, if you attended a nightclub or a festival, for example, maybe you got some new headphones, maybe things like that. No? Okay. So you've not had any sort of sudden changes to diet, exercise? No sudden health changes other than these problems. That's fine. Okay. Moving on now to your scalp sensitivity. Whereabouts is it that you're feeling a sensitivity? All over your scalp. Okay. And if you could describe the sensation to me, what would it feel like to you? Right, okay. So like a tingling, fiery, hot sensation. Okay, that's fine. Yes, and regarding to the lump behind your ear, which the right side again, okay? Right side lump. I'll have a look in a moment, but when did that arrive? About the same time, okay? All right. And again, you haven't experienced any sort of head trauma, nothing that you can recall, any falls or bangs to the head? No, okay. That's fine. Okay, so let's have a think about how I'm going to go about this. I am going to do the examination on you now, or perform the examination, but I do believe that we're probably going to get you to have that lump biopsied, just because of the correlation symptoms happening all at once and quite suddenly seems to draw up a little bit of concern, so we'll get you booked in for that as well. But I will make sure that we have a good look at it first, just to determine if there's anything wrong with it. Final questions before we begin. I do apologise. Regarding your scalp, was there any new products that you potentially started using? So any new hair brushes, shampoos, conditioners, hair oils? Have you had your hair dyed or hennaed recently? Right, okay. It does sound like a henna reaction, yes. Have you noticed any redness on your scalp? It does sound like a henna reaction, but of course, because you've had the other issues as well, we want to cancel everything out, make sure that nothing is untoward. So, let's begin. I'm just going to begin by simply examining your overall health. So we're going to take your vital signs first, okay? So, if I can start off by having a listen to your chest. So if you could lift your top up, that's great, thank you. Okay, I'm going to come quite close to you here. I'm just going to listen to your lungs for a moment, okay? So if you could just breathe nice and normally for me. That's great, keep breathing nice and normally. Good, nice and relaxed. Okay, and now take a deep breath in. And out. Okay, good. Over this side, deep breath in. And out. Okay. I'm just going to reach around the back of you, alright? Stay nice and still. Okay. Just continue to breathe normally for a moment. Okay, and deep breath in. And out. Deep breath in. And out. Okay. I don't see any problems there. Pop this down. Okay, I'm just going to take your pulse using this oximeter. Could you just put this on your finger just like so? Okay. Just give it a minute. Okay, so your current heart rate sitting at 73, that's nice, and oxygen levels currently at 98%. Very good. Okay. Let's take a few notes as I go along as well, just so that we can keep ourselves updated. So, lungs sounding nice and healthy. And 73 and 98% oxygen levels. Okay, that's great. Okay, and then next I'm going to take your temperature. So I just need to take this ear by ear, so just stay still. And the other side here. Okay, that's great. So it's in at 37.1. Okay. Lastly, for your vitals, I just want to take your blood pressure, okay? Alright. Okay, let me just strap this onto your arm here. Okay. tested your vitals and they all seem fine. So what I'm going to do next is I'm going to have a little look at your eyes, ears, sense of smell, have a look inside your mouth and have a look at your nerves, okay? So I'm going to do a little bit of a cranial nerve, okay? Now this is just to examine your overall general health, okay? So we're going to begin with the eyes. I've got a few different examinations I want to do with you today. I'm going to start off first and I'm going to be testing for your pupil dilation, okay? So what I'd like you to do is to focus on the wall behind me. I'm going to come nice and closely here and I'm just going to gently flash the light into your eyes to check for your pupil dilating in and out, okay? Okay. Good. Okay. Good. Good. Okay, and the other eye here. Okay. Good. Good. Great job. And I'm going to put my hands in between your eyes here and just flash from side to side, just like this. Good job, keep going. Okay, I'm just going to swing from eye to eye here. Good. Great job. Now I seem to have lost my occluder, so I'm just going to do this with my hands. I'm going to cover your eye one by one, and then uncover, cover, uncover. Okay? Okay. Good. Good. And on the other side. Good. Great job. Okay. And now switching between the two. Great job. Let me just make a couple of notes here. Okay. Next, I want you to draw your attention to the snellen chart behind me, and I'm going to be asking you to read it from both eyes and then each eye at a time. Okay? Okay, so I'm going to point to each letter, and I want you to simply read aloud for me. Good. 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 Okay. Good. Can you keep going? Okay. Good. Mm-hmm. Can you keep going? Any more? And to try the next line. Good. Mm-hmm. Good. Mm-hmm. Okay, and now let's cover one eye. Let's cover your right eye first. And let's start at the top again. Okay? Good. Good. Okay. Good. Mm-hmm. Mm-hmm. Good. Good. Keep going. Good. Mm-hmm. Okay. Good. 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 Mm-hmm. Very good. Can we keep going? You can't read this line. Okay, let's switch now and cover the left eye. Let's see if your right eye is any better. Okay. Good. Mm-hmm. Good. Good. Yeah. Mm-hmm. Good. Good. Mm-hmm. Good. Good. Okay, can we read this line? Yes. Good. Good. Mm-hmm. Good. Good. And how about this line here? Yes. Good. 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 How about this one? No? Okay, that's absolutely fine. Alright. Okay, let me just make a note of your results. So it seems as though your right eye is slightly stronger than the left. Mm-hmm. Okay, next I'm going to be examining your peripheral vision. There's a few different exercises that we do to examine this. So I'm firstly going to ask you to keep your head nice and still and keep your eyes on a focused spot, so whether that's on my nose or if that's a point on the wall behind me. Okay, I'm going to be bringing my hands in and I want you to simply tell me when they appear in your field of vision. Okay, so for example, I can't see my hands out here, but I can see them about here. Does that make sense? Wonderful. Okay, pick your point. Ready? Good. Remember, nice and steady head there. Good. 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 Let's do that one more time. Mm-hmm. Very good. Good. Good job. Okay. Let's cover your right eye here. And let's do the same again. Good. 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 Great. And now covering the left eye instead. Good. 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 Well done. next peripheral test, I'm going to be holding up a few different numbers, and I want you to simply tell me what number you see. So again, head nice and still, keep a focus point wherever you'd like that to be. Okay, I'm going to step a little bit further back here. Ready? Good. Okay. Good. 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 Okay. Good. Great. Okay. Let's do that again. Let's cover the right eye now. Ready? Good. Very good, okay. Covering the left eye now. Let's do that one more time. Ready? Good. 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 Very good. Okie dokie. Let me just make a few notes here now. Okey-dokey. Last peripheral test, similar to the one that we just performed. I want you to again keep your head nice and still, focusing on one point. I'm going to be wiggling either my left, your right, or my right, your left, and I want you to tell me which side is wiggling. Okay? Ready? Good. 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 Okay, covering one eye again. Let's do the same. Ready? Good. Good. Okay, and then covering the other eye now. One more time. Ready? Good. Good. Very good. Okay, that's the end of your periphery test. You passed with flying colours. I think overall your eye health is absolutely great. You seem to be able to read the chart to quite high standard. We don't tend to expect somebody of your age to be able to reach the bottom lines anyway. So I'm happy there. So let's move on now to your sense of smell. I have these lovely little vials with me. Each one has a different scent, and I simply want you to tell me what you can smell. Okay? So we'll start off with this one. I'm going to waft it underneath your nose like so. What can you smell? Lemon, good. Okay. Next. What can you smell? Strawberry, very good. Okay. And what can you smell? Try again. What can you smell? Okay, like outdoorsy. It was pine. So, yes, I'll give you that one. Okay. Next. Okay, what can you smell? Cinnamon, very good. Okay. And last one here. What can you smell? Garlic, very good. Not such a pleasant one to be smelling. Alright. So the smell seems absolutely fine. I'm just going to have a quick little look into your nose if you don't mind. Let me just grab my torch. Okay, stay nice and still. Just gonna have a look up here. Good. Okie dokie, that's absolutely fine. So, I'm going to move on to your ears now. We're going to do a little bit of a hearing test. But firstly, I'd like to have a little look inside your ears, if that's okay. Just keep my torch out. And let's have a look in this ear first. Good. Okay, and the other ear here. Okay. Right, so both of your ears look nice and healthy. I'm going to do some hearing examinations on you now, okay? So, firstly, I have this tuning fork. I simply want you to close your eyes and tell me when you can no longer hear it. Okay, so close your eyes for me. Good. And again. Very good. Very good. Okay. Just right some lines here. So you can effectively hear it low frequency. That's great. Okay. And now I'm going to be fluttering my fingers in either one of your ears, keeping your eyes closed again. I want you to simply tell me whether it is in your right or your left ear. Okay? Good. Okay. Good. Good. Both, that was a trick. Well done. Okay, and now I'm going to be making the same sound again, but getting further and further away, and I want you to tell me when you can no longer hear the sound, okay? Keep those eyes closed for me. Good. And again. Good. One more time. Good. Okay. I'm now going to whisper some words from side to side, and I just simply want you to repeat the words back to me. Okay. Switch. Switch. Very good. suffering. Good. Switch. Switch, very good. Stipple. Stipple, good. Umbrella. Umbrella, okay. Click. Click, good. Fabric. Fabric, good. Book. Book, very good. Okay, you can relax for a moment. I'm just going to make some more notes, okay? So I'm happy with your hearing. It doesn't seem as though you've got any significant loss. I know that you're saying that you're suffering with hearing loss from this side. I don't see any sort of significant issue. There is no bacteria and no earwax build up at all. Your ear looks nice and healthy. There's no infection. I am going to examine around the ear for that lump as well, okay? But for now, I don't see any immediately hearing loss. But if it's something that you want to explore further, we can again book in for a hearing specialist to do an examination on you. We have a great audiology department. Okay, let me make a note of that. Okay, right, moving on. Lastly, I want to test your sense of taste before we move on to the muscle, okay? So, firstly, I just want to have a little look inside your mouth, if that's okay. Let me just see, I should have a tongue test here. Here we are. My large group of toys and equipment. Okay, I'm going to pop this on your tongue. I'm just going to have a little look inside your mouth with my mirror and my torch, okay? So, if I could just ask you to hold that there for me. That's great. Okay, and then I'm just going to have a look inside here. Okay. When was the last time you went to the dentist? Okay, it looks as though you could potentially do with a plaque clearing, okay? You just got a little bit of build up, particularly on the back side of your upper teeth. But I don't see any immediate cavities. You may benefit from an x-ray, of course, but I don't see any immediate ones. Otherwise, the mouth looks nice and healthy. I don't see any infections, any white spots, any redness, any pus or oozing. Do you say you've got a sore throat at all? I know it's very common this time of year. No, you're all clear with that. Okay, that's fine. It looks nice and healthy. Okay, could you just do a few tongue exercises for me, please? So, I'm going to ask you to pull out your tongue. Good, and put it to the roof of your mouth. Good. Point it that way. That way. Can you roll your tongue? Great. Okay, give me 1 second. Okay, last taste test. I have 4 different vials with me. One of them to show you. They look just like this nice little glass bottle. Has a nice little pipette. So I have 4 of these. 1 salty, 1 sweet, 1 sour and 1 bitter. I'm going to randomly give these to you. Just drop 1 drop on your tongue and I want you to just identify to me which you can taste. Okay. Sweet, good. Okay, next one here. Sour. Very good. Bitter, very good. Pretty sure that you can guess which the last one is. But well, do the test anyway, for continuity's sake. And just confirm to me that that tastes salty. Good. Okie dokie. Well done. Very happy with that. That's the end of your taste test. Okay. Okay, so moving on to your muscles now. We're going to be doing a few different tests again. I want to test sharp versus dull, your nerve sensitivity on your face and your arms as well. We're also going to test hot versus cold. Okay. So I'll get the sharp versus dull to begin with. Okay, so first we have sharp and dull. I'll let you know what these feel like. So here is sharp and here is dull. Okay, I'd like you to close your eyes and just simply tell me which you can feel. Okay. Sharp, good. Dull, good. Dull, good. Sharp, okay. Sharp. Dull. Sharp. Dull. Dull. Sharp. Very good. Okay. And then again with cold versus hot. So I have these two glass orbs with me here. Okay. This one is cold. This one is hot. If you like to close your eyes. So this is cold. This is hot. Okay. Ready? Cold, good. Good, cold. Hot. Cold. Hot. Hot. Cold. Hot. Cold. Cold. Hot. Very good. Okay. So I'd like you now to again pull some funny faces for me. I'd like you to puff out your cheeks. Good. Okay, and then give me a big smile. Okay, frown for me. try and squeeze your eyes shut and don't let me open them. Okay, that's great. I'm going to push on different points of your face. I want you to resist, okay? Good. Good. Very good. Okay, I'm just going to have a little feel of your face now. I just want to analyse your skin texture and facial symmetry here. Have any loss of sensation? You can feel every touch. Okay, I'm going to touch you in a few different places. I want you to close your eyes and I want you to tell me where you can feel me touch, okay? Forehead, good. Good. Cheeks, good. Nose, good. Eyelids, good. Jaw, good. Lips, very good. Okay. That's great. Okay. Just want to do a few reflexes of the body and then we'll move on to analysing your scalp and the little lump, okay? You're doing really well. Thank you for being so patient with me. Okay, so hand strength next. I want you to grasp my hand as hard as you can. Very good. I'm going to pop my hands in between yours. I'm going to push out. I want you to push my hands in. Good. And let's switch. Try to push mine out. Good. Could you push against me? Good. And now pull me towards you. Good. Okay. I'm going to push your shoulders down. Try to push them up. Good. Okay. And lean forward. Good. Try and lean back. Okie dokie. Right. Let me just grab. Okay. I'm just going to tap this onto your knees now, just to check your reflexes, okay? Try and keep your legs nice and relaxed. Good, on the other side. Oh, that's great. Okay, right. Let's make a quick note and then I can move on and have a look at what you're worried about. As I said there, I don't have any issue with your hearing. But again, we can book an audiology appointment for you. Okay, let's have a little look at your scalp. If you could stay nice and still, I'm just going to get quite up close here now. So you're saying that it's all over, no particular spot? No. Okay. I don't see any immediate sort of rashes or redness. Is it actually hot and painful to the touch? So it's got nothing to do with like the sensation, it just feels that way. Okay. Yes, okay, and you can feel everywhere I'm touching here, yeah? And they all feel equally as painful. Okay, no sore spots when I'm pressing, no. Okay, alright, my lovely, let's have a look behind this ear here, okay? Let me just have a look here. Right, I see. Oh, my sweetheart. So that appears to be a lymph node. It does appear to be a little bit swollen. You said you're not feeling unwell at all. You haven't got a sore throat? No. Okay. Right. Okay. Okay. So let you know straight away that I'm not concerned about that lump. Can I just have a little feel of your neck? Just compare it to your other lymph nodes here. Okay. All of the other glands seem completely fine. Not raised. It just seems like this one behind the ear. It's a common one. That's usually associated with sore throats, but you said that it's been up for a good few weeks, and you haven't had any illnesses, colds during that time. Okay. Well, best thing I can do for you then. Personally, of course, I'm just a general practitioner. So from my own personal knowledge, I can't identify anything in particular that may be wrong at the moment based on what I've seen today. But what I'm going to do is I am going to refer you to the audiologist, but I'm also going to refer you to a specialist who specialises in glands, lymph nodes, the throat. Just have your thyroid checked as well, just because it's around that area of concern. You're not experiencing any soreness? No, it's just a little lump. Okay, that's fine. And then with your scalp sensitivity, I'm going to refer you to a dermatologist to check that out for you. Maybe take away a little skin sample so we can do some testing on that. They don't need to cut into, they can just flake off some of the scalp, okay? Nothing to worry about. And I am also going to refer you to have an allergy test, just so we can potentially eliminate anything that might be causing that reaction. Does that sound okay? I know it's been quite a lot for you, bless you. But overall, I think you're taking care of yourself really well. I like to see the diet, exercise is really good, well done. We don't get many people saying that, they rate themselves an 8 out of 10 in terms of health. We more get out 5s and 6s, so you're doing really well. So what I'll do is I will put in a referral for you, and you'll be contacted by our reception with the bookings for those appointments. Those will be at the hospital, not at the GP surgery, okay? Alright, no problem. They should take about 2 or 3 weeks. But if anything gets more concerning during that time, if you feel, really unwell at any point, or if it's unbearable pain, or if you notice that lump gets any larger, for example, please immediately go to A&E. Please don't risk it. We love to see you there. If there's a genuine concern, we want to make sure that you're taken care of, okay? Alright, lovely. Well, it's been great having you here today. Please do let me know how you get on, okay? Alright, have a great rest of your day. Bye-bye now. Bye.